And we know a lot about them for up to 4 weeks. Beyond that, this is why we're here today. So, what is the basic science of the benzodiazepines? And I think the conclusion I reach is that it depends. There is a Dr. Wright who's going to talk to us a little later. There's wrong. And then there's something in between. So, what we know about the benzodiazepines, we know very well. We know extremely well. So if you were to ask me or Dr. Vanderall or any of the other pharmacologists here, we would be able to give you in great detail how these drugs work as anxiolytics. And we've known that for many years now, that the action obviously is on the brain, and that it involves a GABA-A receptor complex, which we know a great deal about. We could even talk about this molecular formation of the receptors, all the different little packets, and how they're arranged in three-dimensional space, either looking at them sort of crosswise or down from the top. We know that it involves the amino acid GABA, and we also know that the benzodiazepine molecules interact with the same GABA-A receptor complex. So it's shown here. Unfortunately, I don't have a pointer that works on that screen, but you'll see there where the GABA, naturally occurring amino acid, which tends to protect us from overexcitation, so we don't have seizures all the time. It's an inhibitory amino acid. Interacts with the GABA-A receptor at a certain special place. Benzodiazepines interact with the same receptor, but at a different site. But what benzodiazepines do is they tend to magnify the effect, the inhibitory effect of GABA. No, that's very nice of you, but it just doesn't show up on the screen. But so what the benzodiazepines do is sort of enhance the action of GABA. So before, where your neurons would respond to some sort of excitatory impulse, now with the benzodiazepines, not as much. So the benzodiazepines don't turn the neurons off by any means. That would not be good. But you just tend not to respond with the same excitation as you would otherwise, which is ideal for somebody with anxiety. And we know exactly how that works. It has to do with modifying the influx or the transmembrane influx of chloride ion. And it hyperpolarizes the neurons and other. I mean, it's a beautiful story. We know all about it. Now, what we don't know so well is what goes on beyond 4 weeks, because I know it's hard to believe, but it just hasn't been studied that much, because these drugs go back many, many decades. And guess what? They were effective and they were safe. So the duration of treatment, it's natural, right? You just say, okay, 2 weeks, yeah, why don't you go another week? Why don't you go another week? You know what? Everything's working well. Why don't you go another week? So it's natural. We're not placing blame. But certainly when you give a drug beyond 4 weeks, there's going to be changes in the receptors. The body is just not going to respond the same way as it did on day one. So there's no question there's down and up regulation of these GABA receptors and the benzodiazepine receptors. Their numbers are physically changing. The body is adapting to what you're doing to it. Functionally, they're changing as well. This has been proven over and over again by electrophysiological studies, chloride, very precise, sophisticated studies. So there's no question that the patient who's been on benzodiazepines for more than 4 weeks, their body is just not the same as it was when you initiated therapy. There's also, and this is startling for those of you who are not basic pharmacologists, what we do is we look for what other receptors do these drugs bind to, and once we have that table of information, we can begin to predict what these drugs do or explain how they work. Nothing. These drugs are so old that it was not typical that they had what we would now call broad screening. So I could tell you, I should have prepared a table. I could tell you exquisitely how these drugs bind to the benzodiazepine receptors. Every other receptor would be totally blank. So we just don't know. It was never thought to be necessary to do it. So we're flying in the dark, and so for a basic pharmacologist, I don't even know where to begin. That's like pharmacology 101. So we certainly know the left-hand side of the screen there. We know how it works as an anxiolytic. We don't know any of these other effects, which we call off-target effects. So then I began to look into it, and I said, well, what is out there? Turns out that benzodiazepines potentiate adenosine A2A receptor-mediated effects. Do you know what that means? I don't know either. Benzodiazepines allosterically modulate alpha-1 adrenoceptors. I do know what that means. They're on blood vessels. So what do you mean? Benzodiazepines are affecting blood vessels? Maybe something to do with the cardiovascular system? Geez, where did I hear that before? Maybe from the patients. I never heard this in my class, and I certainly never transmitted this to all thousands of students. Benzodiazepines possibly are agonists at oxytocin receptors, so now we're involving the hormonal system, and I'm hearing the patients even louder. So as a result of really trying very, very hard, do you remember the movie Billy Madison? So Billy Madison so on the left there, the person asks him a question. Billy Madison gives this long, crazy answer. And the moderator says to him, everyone in this room is now dumber for having listened to you. And that's exactly how I felt after putting in all this time and effort trying to figure out what these benzodiazepines are doing. I felt the more I was looking into it, the dumber I was getting. And I came to agree with Alice. It would be nice if something made sense for a change. So I said it's time to change the way I look at this. Instead of starting with these drugs relieve anxiety, how do they work? I said, let me step back. Let's imagine a patient that I'm giving a benzodiazepine to and ask what happens to them. So clearly the benzodiazepines go up into the brain and they relieve anxiety. Then I found this paper, and this is a scan of benzodiazepine binding not to the brain, but the rest of the body. And I was just stunned. Mostly these types of scans, there's a little bit of a light here, a little bit of a light there, and you try to figure out what it is. The whole body is lit up here. So how could that be? Well, we didn't know this because the people who studies it have a different name for these receptors. But they're really peripheral benzodiazepine receptors, and that's the name we're going to be calling them by now. And what's lit up there? Mitochondria, right? The cell's energy supply. So, geez, what would somebody look like who is having problems with their mitochondria? Maybe they wouldn't have a lot of energy. And every patient would be different. It would depend on the time of day. It would depend on your level of exercise. It would depend on all these things that the patients are telling us. Would any two patients have the exact same symptoms? No. Where else are those peripheral benzodiazepine receptors? They're on immune cells. So what would the patients look like? Maybe a few more colds in the year, or this, that, or the other thing. So it suddenly reminded me of lupus, where two people could have lupus and not share a single symptom. So it could be something. So now I was very intrigued, and I said, well, what else could be going on? Well, you know, I'm not here to tell you the answer because I don't know the answer. And maybe that's my fundamental message, and that's the message that maybe the FDA has to hear. We don't know. I looked real hard, and I don't know, and other people aren't even looking. So what would just be logical? Well, there'd be changes in, polymorphisms, everybody's individual genetics, either in terms of receptors or metabolism. I mean, this again is just pharmacology 101. What about protein synthesis in either direction? Epigenetic changes, right? We all know that that's very important. So just one's environment is going to make a big difference. What about nutritional factors? Never ever been looked at, but actually the whole issue of nutrition and GABA A receptors and benzodiazepines was looked at many, many years ago right here at the University of Arizona. Professor Hank Yamamura, famous pharmacologist, and he actually began to question some of these things many, many years ago. No one has really followed up on that. And then there's even a theory, a biochemical theory, pretty complex, but it, could make sense. But anyway, what I'm trying to say is, all these things are probably going on, and we just don't know. And so I wish I could tell you the answer to this, but I can tell you this, that for 2 to 4 weeks, if you're asking just about anxiety, and we're going to hear in a minute about the question of pain and muscle relaxation, we know a fair amount. And probably things are okay. But I can tell you this, there are now better drugs for almost every one of these conditions. What about 2 to 4 months? We don't know much at all, and it just hasn't been studied. 2 to 4 years, we know nothing. And these poor patients, it's one thing to say they were guinea pigs, they were put on these drugs for 2 to 4 years. Here's the real sad part. Nobody followed the experiment. The guinea pigs were allowed to go on. Nobody was collecting data. Nobody was taking notes. And nobody was keeping track.